It's October 31st, 1991, over the Atlantic. The winds are blowing over 120 miles per hour. The waves are over 100 feet. 3 independent systems have collided to form the 3 independent weather systems have collided to form the perfect storm. Meteorologists have deemed this a rare combination of events and said that it couldn't have happened at any other time, any other moment, and lives were changed forever. It's June 10th, 2017, and we are sitting in dentistry's definition of the perfect storm. Opportunities are limitless. 3 independent systems have collided. The age of information, dental technology, and medical research. They have converged to form a rare combination of events. Scientists are now confirming the links between oral conditions, heart attacks, infertility, strokes, memory problems. Dentists are sitting on panels with endocrinologists and cardiologists discussing comprehensive health care. More and more physicians are coming to us to obtain dental clearance before they can perform surgeries. And we have an academy that is focused on oral and systemic links that is absolutely exploding. No greater time than right now in dentistry. And it doesn't matter. It doesn't matter where your practice is located, the socioeconomics of your patients, the ethnicity of your clientele. It is immaterial to your ability to be extremely successful and to literally save thousands of lives. It hasn't always been this way. The author, Mary Otto, has written in her book, when she talks about the separation between medicine and dentistry, she talks about the historic rebuff, where 2 self-trained dentists went to the University of Maryland in Baltimore and asked that dental instructions be included in the medical curriculum. And they were told no, that dentistry was no more than a mechanical challenge, and it was of little medical significance. That was the prevailing opinion then, and for many people, they think that way now. This has caused dentists to be seen as tooth doctors versus physicians of the oral cavity, and has devalued our services in the eyes of our patients as well as in the eyes of other doctors in other branches of medicine. But you know what? The past does not have to define us. I believe that any dentist in this country who struggles with the lack of new business, the lack of prosperity and profitability, the lack of passion and joy for what they do, it's because on some core level, they consider themselves separate, or the work that they do is separate from the practice of medicine, as if it does not involve whole body health. So tell me something. If we're in these perfect storm conditions, why aren't we all rich, feeling fully empowered, or filled with passion and joy every time we go to work? Why is it that we have colleagues who are struggling to make their expenses, or unmotivated employees who come to work late every day complaining, or this culture of drill and fill patchwork dentistry that does not serve the health of our patients nor the health of our practice. Or that patient who comes in needs a lot of work, only want that one tooth done, and only if the insurance will cover it. You know what I mean? Absolutely. A 3-word answer. Perception, perception, perception. Perception number 1. How do we view ourselves? What's our self-image, our mindset? I run into colleagues who do not consider themselves medical professionals. And I run into other physicians who look at dentists as if we're lesser than they are. In my consulting practice, I work with a lot of dentists who want me to come in and train them to have a more profitable practice and to practice more comprehensively. But what I realize is that when I watch how they run their business, 75% of them leave money on the table by doing that one tooth and only what insurance will cover. Perception number 2. How do our patients view us? Are you a tooth doctor, or are you an important part of their medical team? Do those patients understand that the work that we provide can make a difference between life and death? Do they understand that 95% of systemic diseases show up in the mouth first? Well, I'm sorry, have oral manifestations. Perception number 3, how does the medical community view us? Do you interact with other doctors? Do they understand that the conditions they are treating will never improve if that patient has undiagnosed and untreated oral conditions? And have they been educated on the fact that the mouth is the gateway to the body? I'm going to share a story about how perceptions have changed my life forever. My brother Tony died in 2014 from complications of a sepsis infection that is believed to have come from his mouth. He was in Texas one weekend and he got really sick, and we thought it was the flu. But after about a week and a half, he became delirious. He was taken to the emergency room. By the time he arrived, his kidneys were failing, his liver was failing. Within a week of being there, both his feet had to be amputated. And he developed bacterial endocarditis. I had the opportunity to examine my brother once before he got sick. I looked in my brother's mouth, and I'm telling you, it was so horrific. I had to leave out of the room, and I cried. And I came back, and I said, Tony, you used to have such a beautiful smile. You could get sick from your mouth being in this condition. And basically what he said to me is, look, you're a dentist. You're not really a doctor. He wasn't trying to hurt my feelings. He just wanted me to fix his front teeth and that one in the back that was bothering him. Perception. Every time I would call the hospital, it took me about 4 days to get to Texas. Every single time I would call the hospital, the doctors would get on the phone, they would share all the information with me. The second day, the doctor said, we don't know where this infection is coming from. And I said, I believe it's coming from his mouth. Every single time I would call, I would feel so anxious that the doctor would ask, what kind of doctor are you? And when I said dentist, the conversation would change. And that's exactly what happened. I'm sharing this with you because it's not just my brother, it's not just my family, it's your brothers, mothers, fathers, it's our patients and family. It doesn't matter if we have the technology, the information, and the research to back it up. If we're not poised to take advantage of this opportunity. So if you haven't already, step into the eye of this storm with me. Let's change perceptions. Let's sell more dentistry and save more lives. Thank you.